Hi, it's Christine. It's June 19th, 2014. I haven't done a video update in a long time. Primarily because I've been going through a lot, and my progression is moving faster than I would like. I think largely due to stress. What I want to talk about today is not so much about me, but I want to talk about vulnerable adults. One thing we all have in common, each and every one of us is going to be a vulnerable adult someday. Sometime some of us might be younger in the process than others. But at one point in time, we're going to need to rely on somebody else to care for us. That can be a real challenging thing. For someone that has been dealing with therapy and counseling and things since I was such a young person, I had a pretty successful life because I knew about my disease when I was young, and I was encouraged to invest my money when I was in my 20s, which made a huge difference. Not everybody has that option, especially people that have been successful and worked. If you find that you maybe got diagnosed with cancer at an earlier age, or maybe you were in the service and you had a traumatic brain injury at a young age, 20s, maybe you have MS and your diagnosis happened and you're young. Well, I'm 47 and I still have my cognitive is good, and I'm very proud of where I am today. I basically want to express that our culture is, do you remember when you were a teenager? It seemed like adulthood was forever away, never going to happen. Well, now that I'm 47, I suppose sometimes when you think your 20s or 30s, you sometimes feel invincible. But as we age, sometimes things progress. For me, that's the case. So I found myself in a situation where I became a quadriplegic, a blind quadriplegic. It's been really difficult to mentor people that are vulnerable adults at certain levels, because especially people with multiple sclerosis, it's such a terrifying diagnosis that when you see somebody like me, possibly you don't want to think about 10 years down the road or whatever. But my point is I want everybody to think about their future. If you're fortunate to have a family to help children, that's awesome. That's great. I get a certain amount of support from my family, and I'm happy for that. I worked really hard, and I thought that that maybe everybody did, but what I did learn is I have coping skills from long-term management of people needing help. So I guess I'm gonna keep it kind of short and sweet. I just want everyone to realize that at some point in time you may have to end up on the Medicaid system, and you might require a certain level of care. And I just want to say that that system isn't really what it should be, as is a lot of things that are going wrong with the world, our country. The system is breaking, and I just hope that at some point in time I'm able to be a voice for people that don't have the means to speak up for themselves. I have survived this far because I'm a very hard worker, and I want to live in my home. I could see how that would be very depressing for some people to lose their home and have to go into some other sort of care. Let's just leave it at that. I hope everybody's doing well. I haven't watched any videos in a long time. Please, we'd like to hear from some people to see how they're doing. And my main agenda is I'm trying to do the best I can to be an advocate at this point. And I hope that it works out, and I hope everybody is doing better, and I'll keep you posted real soon. Bye.